Okay, so exercise 2, ABO blood typing, and we're still in prac 5. And so Fleur's going to demonstrate the procedure to actually determine what antigens human bloods carry. So the first, what we're actually setting up is the positive controls. And so as you know, as you hopefully know from reading the notes, people have A, B or O blood types. And this is due to the presence or absence of AB antigens on blood cells, and then also whether they're A plus or whether they're, plus or minus. So what Fleur's going to do is she's going to dispense our B sample, our positive control. She's taking 20 microlitres and transferring it into each of the 3 wells on the test plate. Notice in this situation she's used the same tip. That's because she's actually transferring the same sample, so that's okay. But now as she adds each of the antigens to the 3 wells, she will actually change the tip in between. When she's aspirating, the pipette is pressed to the first stop. When she's dispensing, the pipette is depressed all the way to the second stop, and then she's discarding the tip in the waste bin. So she'll repeat the procedure, acquire the tip, close the lid, aspirate from the first stop, and expel by pressing to the second stop. And then finally, one more, taking the tip, closing the box, depressing stop 1, down, aspirating, expelling stop 2, or the second stop, discarding the tip. Okay, so with the positioning of the 2 reagents, so the fake blood sample and also the antigen, they're separate at the moment, and now we will mix them and look for the reaction. And if the reaction is positive, the sample starts to agglutinate, or you see small clumps forming within the sample. So we've got either A blood type, B blood type, or O blood type, or AB. And then we have plus or minus. Okay, so the reaction does take, it's fairly quick. It can take a bit longer than about a minute or so. And we can actually already start to see, I'm not sure if the camera's catching this, but you can actually start to see the clumps forming in B. So on the diagnostic plate, we have A, B, and then RH plus or minus here. So what we would expect for this sample is, because we know that the positive control is B, we would expect to see clumps in B, so the agglutination there, and then we would not expect to see the liquid staying in suspension in A. And then we can see that there's agglutination in the RH factor, and so there, that's B positive. Now we've actually set up controls for all our blood types, and they're not in kind of any odd order at the moment, but what you'll do is you'll need to complete an exercise, and you'll use these positive controls, and then you'll use some still images that we give you to go through and work out the type for 8 patients, and we'll give you more information on how to submit that information in the prac notes.